guys, it's Nurse Desi. I'm back with another video. If you guys are new to my channel, let me introduce myself. My name is Destiny. I am a 22-year-old registered nurse. I currently work in a medical surgical ICU. If you guys have not been watching my channel, I graduated nursing school December of 2023. I passed my NCLEX in January of 2024, and I started working in the medical surgical ICU in February. So I am currently on orientation. I am on my week 12 of orientation, and my job offers us a 16-week orientation, and I just recently switched over to night shift. So if you guys are interested in new grad nurse content, navigating how to be a young 22-year-old nurse, and also starting out in the ICU, follow my channel. Please like, comment, and subscribe. And let's get into this vlog. Okay, guys, so it is Wednesday, May 22nd. And the reason why I'm dressed up in scrubs is because I'm on the way to work. And y'all, today is an exciting day. I'm actually presenting our final project for my medical surgical ICU. So we, at the very beginning, we got assigned a topic or certain topics to present to our educators to show that we are competent and we've done the research on some of the things that we see in our medical surgical ICU. So I got assigned end-stage liver disease, and I also got assigned portal hypertension and esophageal varices. So that is what I'll be presenting today. And y'all, this is just like nursing school. If y'all have ever been in nursing school, y'all know that you normally have to do like a final project. When you graduate, you got to present it. So it's literally like nursing school all over again, but it's less formal, of course. My educators, they wanted us to have a whole PowerPoint, but they're saying it doesn't have to be in APA format. You know how nursing school is just very strict. It's not as strict as nursing school, but they still want to show that you're competent, and they want you to understand the type of patient population that we see. And we actually get a lot of liver patients, so I'm kind of glad I did get assigned end-stage liver disease, because we see this all the time, y'all. And if y'all ever know about liver, when the liver fails, everything fails. So I'm going to show y'all my PowerPoint and just show y'all what I'll be talking about and how I created this PowerPoint, and then I'll let y'all know how the presentation goes. Yeah, I'm a little nervous. It is 10 of us in our residency, so we each have topics. So everybody will have a topic. Like, for example, some people have sepsis, some people have pulmonary hypertension, some people have just the main type of diseases that we see, like kidney failure, all that. So we'll be listening to each other's presentations just like in nursing school, and then our educators will be asking us questions. Our manager will be there. So it's very important that I do well in this project. So I'm going to show y'all my PowerPoint, and then I'm going to head to work. Okay, y'all, so here is the first slide of my PowerPoint. I have a healthy liver and then a liver with cirrhosis. I'm going to start off with a case study, and then I'm going to first go over all of the pathophysiology of the liver, y'all. So if y'all know that the liver does almost everything. Detoxifies our body, metabolizes drugs and other things, stores minerals, produces bile, produces all our important protein substances for our clotting factors and for our blood plasma. It has immune system responsibility, just everything, y'all. So I'm going to go over the patho and the functions of the liver. Then I'm going to talk about what end-stage liver disease is, chronic cirrhosis, and then also acute failure of the liver, and then our signs and symptoms that we will see in a patient. And then I'm going to go over diagnostic studies. I'm going to talk about the anticipated lab. So for y'all know, patients that are in liver failure, everything's going to be out of whack. The coagulation is going to be out of whack. Albumin low, bilirubin elevated, ammonia levels elevated. The patient's enzymes, their liver enzymes will be elevated. Creatinine will eventually start being affected. Just a lot. And then more complications. I'm also going to talk about the treatment and some things that we do in the ICU for patients that are in end-stage liver disease. And I'm going to talk about DIC, because that's another complication that can happen. There's a very severe complication, blood disorder, clotting disorder. Patients that are in this disease process are more susceptible for DIC. I'm also going to talk about CWAL protocol because a lot of patients, the reason why they are in some type of liver disease is because they have an alcohol abuse disorder, and that can also lead them to withdrawal. So sometimes we're treating multiple things at once. For CWAL is the alcohol withdrawal clinical assessment that we use. And then the treatment for CWAL, we typically give benzos. The patients would need to be on a lot of nutrients, thiamine, folate, excessive, like checking their neural status, just a lot. And then if it's very severe, the patient can end up being on Precedex or propofol. And then we do get transplants of the liver on our unit. So I'm going to be talking about post-liver transplant. This is typically how the patients look when they come back. They are jaundiced, they're intubated, they got a lot going on. So here's some of the meds that we give post-transplant to prevent the rejection of the liver. And then next, I'm going to be talking about esophageal varices and portal hypertension. So I'm going to have another case study with a patient that is pretty much having a GI bleed, esophageal varices, which is a complication of portal hypertension. So I'm going to talk about the path of portal hypertension and how over time the portal vein has increased pressure because of the cirrhosis. It increases the intrahepatic vascular resistance and also increases portal blood flow, which causes the veins in our esophagus to be very dilated, and then the walls thin, and then it's more susceptible to rupture. So that is what an esophageal varice is when the veins in your esophagus are just so dilated, enlarged, and then the walls of your esophagus begin to like erode, and patients can be susceptible for life-threatening bleeding. Y'all, if y'all ever seen a patient that has esophageal varices, it is probably one of the scariest deaths ever. Like, you're bleeding out of every crevice, and then the patients that are in liver failure already have a high risk of bleeding due to the clotting factors are interrupted, so your body's not clotting like it should, so it's excessively bleeding already, and then you're already bleeding from your mouth. Sometimes they can have a lower GI bleed, so it can be so traumatizing, y'all. So of course the initial management is trying to immediately stabilize the patient, control the bleeding, give blood products, do everything, IV, central line, IV fluids, all that. And then the management try to trend their CBC, make sure they're not continuously bleeding, and then they'll eventually have to go under some type of procedure to ligate the varices. And then if it's very severe, y'all, they could end up getting a balloon tamponade, which I'll be talking about later. And then some other meds that we can put the patient on, protonics and octreotide, to help stop the bleeding. So now I'm going to talk about a patient that is going to be getting a Blakemore tube, which is a balloon tamponade. And if y'all seen one of these put in, this is also very traumatizing. So here's a Blakemore tube. It is a large balloon that is going to go into your esophagus and in your stomach, and it inflates in order to put pressure on the bleeding. So it is very invasive, but it's something that has to be done if you're having life-threatening bleeding. And it's only a temporary fix. It's not something that you can have in for longer than like 2 days. But here's our nursing considerations. Of course, you got to monitor the airway, because any movement in the tube can cause a patient to aspirate, and the airway can be like obstructed. And then the patients that have this tube must be intubated as well. And then a TIPS procedure is pretty much what a patient would have to undergo if they are continuing to have esophageal varices. And it's pretty much a shunt that shunts the blood from the portal vein directly to the hepatic vein, bypassing the liver. So it can try to decrease the portal hypertension and risk of bleeding. And that is the end of my project, y'all. So hopefully it goes well. And yeah, I'll let y'all know how it goes. Hey y'all, so I am out of my presentation, and y'all, everything went great, y'all. I don't know why I was nervous. I was presenting in front of my cohort. It's 10 of us that are starting in the ICU that are new grads. And then it was my educators and my manager. And y'all, they done nominated me to go first. So I was the first person to present, which is always like, it's good to get it over with. It's good to be the first person, but then you are the one that's kind of like setting the bar. So everyone said I did good. They said I set the bar. Everything was good. So at the end of the presentation, my educators were like asking me follow-up questions just to make sure that like I understand everything. And like, it was good, y'all. I went through all of the presentation pretty much without looking at my notes, like, because they want to know that you're confident in actually teaching this stuff. Because if you have a patient that is in this type of process, you want to be able to explain to the family, to anybody that's around, what's happening to the patient without having to, like, you know, go and search up resources and all that. So it was good. And then after my presentation, I listened to all my other cohort to their presentations, and I actually learned a lot. Like, we all learned from each other. We all got to clarify on certain things that we didn't know. And it's just crazy that like I'm done with all of the ICU classes. So this presentation pretty much is symbolized us being finished with our ICU residency. So we are still in a residency program, so we'll still go to our monthly classes, but they're not with our unit educator. It's with the hospital like residency coordinator. So it's like two different types of classes, but we're finished with our unit classes basically. So that's like good and kind of scary at the same time, because like the educators are always there to help us, like if we're ever having something where we don't understand. But when we get off orientation, you just feel like you're kind of by yourself. Like you feel like you have to just fend for yourself. So that's the hard part about being off of orientation or done with classes, is that now like you just have to hope and pray that you have soaked in all the information. But of course you still have resources. You have your charge nurses, you have people to go to, but you want to know that you at least know the majority of this stuff before you get a patient and you've never had that type of patient. So I'm just excited. I'm excited about being done with this portion of my residency, and now I can pretty much just focus on working, doing night shift, and learning how to be an ICU nurse. So that is exciting. I don't work for the next 2 days, so I'm debating on if I want to keep this vlog going or if I want to go ahead and end this off, depending on how long it is. So I'll come back and see if we're going to keep this vlog going or not. But I'm on the way home. I'm about to take a nap, y'all, because I'm tired. But we did get out way earlier than expected, so a win is a win. But I will talk to y'all a little bit later, and bye.
See, my days are cold without you, but I'm hurting while I'm with you. And though my heart can't take no more, I keep on running back to you. See, my days are cold without you, but I'm hurting while I'm with you. And though my heart can't take no more, I keep on running back to you. Baby, I don't know why you're treating me so bad. You said you love me, don't wanna find me, and I was all you had. And all my heart is beating for you, I can't stop crying. Treat me this way and still I stay.
Hey you guys, today is Friday, May 24th, and y'all did not come back to y'all yesterday. I was at the mall all day because I didn't tell you guys, but I am going on a vacation next week, and I'll tell y'all where I'm going in my next week's vlog. But I'm getting prepared for vacation, so I was at the mall finding me a whole new outfit because this vacation is kind of last minute. I didn't have time to order a whole bunch of clothes, so I literally was at the mall all day, and I found an outfit for every single day that I'm going, and I'm very picky with my outfits. So I'm so happy, like the look is coming together. Like I'm going for a very classy, clean, just very chill vacation vibes, but just cute because I want to take nice pictures and all that. So found cute outfits for every day that I'm going. And this trip is mainly for vacation, but it's also some things that I want to do when I'm out there, and I'll tell y'all a little bit more about that later. But so I had to find outfits for specific occasions, so that was really the hard part. But everything's coming together, y'all. I started packing. So today is gonna be my maintenance day. So I already have my lashes done because I got my lashes done last week. I'm going with this hairstyle because I will be getting in the water, so I didn't want to get sew-in or a wig or something, and then my whole hair be falling out. So I'm going with this hairstyle. It still looks pretty good, even though I got it done last week. It still looks pretty good, so I'm going with this. But I needed to get some more accessories. I got some like necklace, bracelets, and everything while I was out yesterday, but I want to get some more like earrings, just vacation accessories, sunglasses. And I got to get my nails done today, my toes done, and what else? Oh, my eyebrows threaded. So that's what's on the list today. I do work 2 shifts tomorrow, and after these 2 shifts, I'm going on vacation. And I feel like that's what gets you through nursing, y'all. When you have like some hard days, you just know, I got to get through these last 2 days so I can go on my trip. Like, that's why you have to always be looking forward to something when you're in nursing. Because if you're just going to work every day and you don't have nothing to do, it can get really depressing, y'all. It can get very depressing. So make sure you keep yourself up, do fun things, do things that make you happy. And y'all, so I went to the mall and I ended up, so I was looking for some new cute like vacation sandals, and I ended up going to Steve Madden, y'all. Steve Madden got 60 buy one get one 60% off. I ended up getting 2 pair of sandals, and I feel like they was worth it. I spent over $100 and something, but they were worth it, y'all. And then I got majority of my clothes from Forever 21, and I'm normally not a Forever 21 fan because every time I go in there, I feel like I can't find nothing to wear. But this day, they had all the cute outfits, like all the cute outfits. So if y'all looking for vacation clothes, hit up Forever 21. I also got some cute stuff from Windsor. Like Windsor is like a cute little store in my mall. I don't know if every state has a Windsor, but Windsor has some cute clothes. I got stuff from Windsor. And then I picked up swimming suits here and there. I did get a swimsuit for Forever 21, and then I got another swimsuit from TJ Maxx. It just happened to be random. I just walked in there and I saw a cute swimsuit that matches one of my outfits. But I think I need like one more swimming suit. So I'm going to look for one more swimming suit. I'm going for 6 days, but I have like some casual swimming suits, but I'm looking for some like cute swimming suits to go under my cover up, stuff like that. So I'll take y'all today for my maintenance day. Let's go get our nails done. Let's go pamper ourselves. So I'll talk to y'all later. Y'all, I'm headed to the nail salon, but I want to tell you guys, y'all, I'm currently looking for a actual camera so I can start making better footage for you guys. My sound be real off in some of my clips, mainly when I'm in the car. And I know the sound is not the best, y'all. I'm trying my best. I'm actually in the works of looking for a camera right now because I'm tired of my footage coming out bad. Like, I don't want to upload footage like that. So please bear with me, y'all. Thank y'all for watching despite my sound being a little off, but I'm going to be upgrading very soon. So just bear with me. I promise y'all better footage is coming, but the down crew, if y'all really mess with me, y'all will stay down until I get my footage better, y'all. I'm really still new to this vlogging, like editing. I'm trying to learn how to get better at editing, how to get better with my vlog footage. So just work with me, y'all. I'm just a nurse. I'm just a girl that be trying to work. So bear with me, y'all. Bear with me. These cameras are expensive, but y'all are worth it. I want to make sure that I am putting out good footage for you guys. So I'll talk to y'all later.
See my days are cold without you, but I'm hurting while I'm with you. And though my heart can't take no more, I keep on running back to you. See my days are cold without you, but I'm hurting while I'm with you. And though my heart can't take no more, I keep on running back to you. Baby, I don't know why you're treating me so bad. You said you love me, no one above me, and I was all you had.
Hey y'all, so I'm leaving the nail shop. Look how cute my nails came out, y'all. They so cute. But look, I'm glad I spoke up because I was in the middle of getting like her putting the French on, and she was like, she did the thinnest French in the world, y'all. I did not even see the white. I was like, where is the French at? Like, what is going on? And she was like, is it good? Is it good? And I'm just in my head like, no, like, now the nail shape was perfect. It was the fact that there was no French. I was like, where's the French? And knowing me, I'm so nice. Sometimes I'll just sit there knowing I don't like a service and not speak up. But I was like, no, I'm spending too much money on this. I'm not finna walk out and my nails not be right. So I was like, can you make them thicker? Like, and I felt bad because she had already did like all of them and they were so thin. I was like, can you thicken these up? Because I need to see I have French on my nails. Like, I need a white actual coat on the top to look like it has French. So she went back, fixed them, and it looks so much better now, y'all. So so glad that I spoke up, got the nails that I want, got my toes done. The toes are perfect. And now I'm ready for vacation. Like, eyelashes done. I went to the mall, got my eyebrows threaded, so those look good. Eyelashes, hair done, nails, everything's done. So now I gotta finish packing. I already got all my clothes. And I was trying to look for some accessories. I did get me some more earrings, but I couldn't find like too many cute accessories. So I may just have to finesse it, find some places that have something cute, or just get something when I'm out there. But main thing I'm looking for is more sunglasses and just cute little gold accessories. So that's what we're gonna do. But besides that, everything's ready for vacation. Now I just gotta knock out these 2 shifts. I gotta go wash my scrubs and everything because I work tomorrow and Saturday. And then starting Monday, I got my flight is on Monday, and I'll be gone until like Friday. Yeah, Monday to Friday. So that's a pretty long vacation. So no, actually Monday to Saturday. Yeah, I'm tripping. Monday to Saturday. I have a 6-day long vacation. So I'm about to have a great time. About to spend the whole time at the beach and vibe out. So I will talk to y'all later, either tomorrow or later today. Bye. Hey y'all, today is Saturday, May 25th. And I am on the way to work. This is shift 1 out of 2, and this is my last 2 shifts before I go on vacation. So let's go knock this out. I'll talk to y'all on the way to work. I gotta grab me some food, and then I'm gonna get to work early so that I can run through my patient's chart and just keep myself up to date on what's going on. And I'll talk to y'all later. Hey y'all, so I made it to work a little early, and like I'm a little way too early. It's like 6 o'clock. We don't have to clock in until 6:40, but I like to get in there at like 6:20 just to go through my patient's chart. And I realized I never told y'all like what's my flow when I first get to work, because I think that's one of the most hectic times is when you first come into work, and then sometimes at the end of the shift it can get a little hectic, but it's the most hectic in the beginning, like on day shift or night shift. It's the most hectic in the beginning. So what's the hardest thing I think about being a new grad is like coming in, it's so much going on. What do you do first? Like, what is my first thing that I need to be doing when I get into work? And what's the first thing I need to be doing when I open up my patient's chart? Because y'all know these ICU patients have a lot of stuff going on. So you can be chart digging for 2 hours if you sit there at the computer and figure out what's going on with these patients, but you don't have enough time to do that most of the time. So when I first get into work, the first thing that I look up on my patient is, y'all, look at them orders. I don't know why, like my first couple weeks of being a new grad, I used to just be coming in, just going through the notes, going through the MAR, just looking at the meds I have due, not even looking at my orders, which is crazy, y'all. I don't know how I was even working without taking a look at my orders, but there's so many orders that ICU patients have. So like whenever patients get admitted to the ICU, our ICU doctors are going to go through everything, and then they're going to put in probably over 100 orders. But a lot of that is like our ICU order set. So it's just like how often you need to be getting vitals, blood sugar, just everything that you do in ICU already. They put in a large order set, but specific patients can have specific things in their nursing order. So like a surgery patient could have how often to empty out their drains. A neuro patient could be like do an NIHS score, stroke score on them every 2 hours. Or if their urine output is low for 3 hours, then give them a bolus of fluid. Like, it's a lot of stuff that is in our order set that may not be on your MAR or on your brain, but it's up to you to go through your orders and look at what you have to do throughout your shift. Because if you go through the whole shift and you're just doing whatever and you haven't looked at your orders, you're not operating within your scope of practice. Like, us as nurses, we have to work under a doctor's order. So if we're just doing whatever and we're not looking at our orders, we are not operating within our scope, and that's going to be your license on the line and causing patient harm. So it's super important. Like, sometimes in the report, the nurse will tell you like specific things, like, oh yeah, like the surgeon wants you to empty the drains Q8 instead of Q4, or the surgeon wants you to do this, or if there's something going on, then to notify the surgeon. Sometimes people will tell you, but sometimes people will forget to tell you stuff like that. And I get it, it's a lot of stuff that we do in ICU, and it's up to you to make sure you go through the order. So you can't just be relying on the off-going nurse to tell you every order that's in there for the patient. You have to be responsible and go through your patient's orders. So that's why I get to work early now, just because you just never know what type of shift you're gonna have, and you don't want to just be like, oh, I didn't know you put that in there, and something happens and you're trying to explain yourself. Like, no, you want to make sure that you're going through your orders and you know what you need to do for your shift. So I write out my orders, and then the next thing that I go to is my notes. So the notes, I go to the most recent note. Typically our physicians or the APPs will write a note on the patient over their whole hospital course, because some of these patients could be here for months, even years. So you need to just know the most important information of what's been going on recently with this patient, what's their history, and what you need to know. So I go over the recent note. It's a summarized thing about what the patient is going through, and then that's when I can start going through my MAR, going through my labs. Y'all, check your patient's labs. And a bad habit that I used to have is that if I was trending labs, like say that you're busy and your patient has like a CBC trending every couple hours, and you're sending off the labs but you're forgetting to recheck the results, I always add a task into Epic to make sure I go back and check my labs, because it's easy to get busy and you forget to look, and next thing you know, your patient's hemoglobin is 4, but you've been running around and you didn't get to look at it. Like, that's not acceptable. You got to look at your labs and look at your electrolytes, because in the ICU we are responsible for checking our electrolytes and replacing them. So the doctor will put in an electrolyte replacement protocol, and if your patient's electrolytes fall under those ranges or above those ranges, you need to go in and order the electrolytes and replace them, because y'all know if your electrolytes is low, it can cause a lot of issues. Your rhythm can start going into arrhythmias, and you're wondering why your patient is throwing PVCs, and then now they're in VTAC, now they're coding because their electrolytes was off. So it's a lot that goes on with those electrolytes. So that's one of the most important things, checking those labs. And then when you come in, you at least know what you need to do, and start adding the tasks that you need to be doing on your brain, so that you are not forgetting about what things you need to be checking. So those are the main things that I do before I even like look at the patient. And then when you finally get a report on your patient, like, I know bedside report is probably the best standard, so either do bedside. But if you can't do bedside, sometimes it's hard to do bedside because there's a lot going on in the patient's room. Families are in there, and it's hard to get a good summary about what's going on because patients have a long history. So if you don't do the full bedside report, get the report outside and make sure you go back in with the nurse and verify your drips that you have going on. The main thing with your drips, you want to make sure that the dose is correct, the concentration is correct, and most important, the weight, y'all. The patient weight needs to be correct, because if they put in a wrong weight, the patient could be getting twice as much of medicine than that they need to be getting based off their weight. So it needs to be the correct weight on all your drips. So checking the weight, and then of course certain drugs you have to sign off on or hand off with the nurse. So like fentanyl, your high risk meds, sign off. But before you sign off on any med, you need to make sure that you verified it yourself. So don't just go signing off and like you haven't checked the rate and everything that's going on. So make sure you're checking all your drips. And then I also come in and put my other patient on the monitor. So if you walk into your patient's room and you have 2 patients, add your second patient in your on your room monitor, so that if you are in your patient's room, you can still be looking at your other patient's vitals. So if something's going on, you can be like, okay, I need to go check on my patient, there's something going on. So that's very important. Also checking your drips, making sure it's not running dry, because it's a lot of critical meds these patients are on. If they're on pressors, you need to be making sure that your pressors are not running out and you don't have enough time to get enough, and then your pressors run dry and your patient starts dropping on you, blood pressure dropping, and you are not paying attention to your drips. And there's a lot of drips that are made by pharmacy, so that's why you got to be on point even more, because it could take a while to get the medication sent up from pharmacy to you. So always know the meds that are on your unit and the meds that come from pharmacy, so you can order them and you can be on top of picking up your bag. So it's a lot that goes on in ICU, y'all. It can be very overwhelming for a new grad, but eventually it'll just come with time. Like, that's why you have to just find the pattern that works for you, find the method. Every preceptor will teach you something differently, but you can take whatever you learn from each preceptor and just add it to your knowledge, and then do what's best for y'all. But make sure that you are on top of it, y'all, because patients' lives is at risk if you do not do things properly. So I'm about to go ahead and get started on my shift. I'm excited because y'all know it's my last 2 days, and I just need to get these shifts over with so I can go on vacation. So I'm gonna, whatever happens today, I'm praying for a good shift, but I will get through it, and I'll come back at the end of the day and tell you how it goes. Hey, you guys, it is May 26th, and it is shift 2 out of 2, last shift before I go on vacation. Y'all, last night, they ran me rampant on that unit, y'all. I'm gonna talk to y'all on the way to work about how my shift went yesterday, but it was crazy, insane. I had 2 very, very sick patients, and I did everything. I did the majority of all the work. My preceptor did help me a couple times, but she's so sweet, and I felt very good about the care that I provided. But y'all, when I tell you it was so busy, like I think that was probably the busiest night shift I've had, and the sickest patient that I've had on night shift. So I'll tell y'all about how the shift went. I'm on the way to work. I gotta grab me some food, and I'll talk to y'all later. Okay, y'all, so I made it to work, but let's get into this shift yesterday, y'all. So I had 2 very sick patients, very critical patients. So my first patient was intubated on CRRT, and the patient had a lot of abdominal surgeries. So the doctors were concerned that the patient may be developing abdominal compartment syndrome, because her belly was really distended, and it was just a lot of things that they were concerned about. So they told us to put in a Foley and start monitoring her bladder pressure. So I've never done that before, but pretty much bladder pressures is when you are measuring the patient's pressure in their bladder, and based on that number you can see if the patient is having abdominal compartment syndrome, because that pressure is going to put pressure on your bladder, and your bladder's pressure is going to be increased. And if that number is over a certain amount, and it could indicate that the patient needs to get emergent surgery, because just like if a patient has compartment syndrome on their leg, they'll have to get it cut open and get a fasciotomy to relieve the pressure. Same thing for the abdomen. If they were to have compartment syndrome in the abdomen, they'll have to get the abdomen cut open. So we had to measure bladder pressures Q4, and I actually had to tell the offgoing nurse, I'm like, I never did that, can you please show me how to do it? And it's actually not that bad. So we have to just lay the patient supine, and the patient cannot be moving at all. And then we have to measure, it's like a transducer. We have to level it at the patient's iliac crest. And then we clamp it off where the drainage bag will be going. And then you hook a syringe to the stopcock, and you have to insert fluid into the patient's bladder. And then you're measuring how much the fluid is, like you're transducing how much the pressure is. And then you'll get your pressure reading, and then you'll release the clamp, subtract that output from your patient's urine output, and that's how you do it. So it's not too bad. But at midnight, the doctor was like, I want to make sure that we're getting like an accurate number. So I just want to paralyze the patient so we can get like a fully accurate number. So y'all, I had to push rock and paralyze the patient. Of course, the patient was sedated. We gave sedation, and then the patient was also on continuous sedation. The patient was already intubated. So we're not concerned about airway and everything, but we just want to make sure that we're getting an accurate bladder pressure, because you don't want to be taking a patient to go get a rapid surgery or some emergent surgery and it's not an accurate number. Like, you want to make sure that that number is, you know, consistent and accurate. So that was cool. Like, I love learning new things, because it's like, soon as you get it, like, you get it. Like, now anytime I ever have a patient that has a bladder pressure, I'm gonna be like, I already know how to do it, like, don't worry. So I do love, like, the fact that every shift I work, I feel like I'm learning something new. Like, something new comes up every day. And being in the medical surgical ICU, I think that was the best place I picked, because I don't like being overly specialized. Like, I don't like being in like a CV or a neuro ICU. I like to see like different comorbidities, different patient populations. I just like to see all types of surgeries, all types of cases, just so I can learn the most. Like, I feel like you learn so much more because we get such a variety of patients that I feel like I have such a broad knowledge that I can go anywhere with. So that is a plus about being a medical surgical ICU. But y'all, so my other patient also was very sick. The other patient was trach and had like over 6 abdominal drains and a chest tube. So when I tell y'all, it was so much going on. So of course in ICU we're constantly doing assessments. We have to do Q4 assessment at the minimum, and if there's anything else going on, it's going to be even more than 4 hours. But being on night shift, I feel like what's the hardest part is that your patients are like trying to get sleep and the family's in there and it's dark in the room. You don't want to wake them up, but you still have to make sure that you get your assessment, y'all, because this right here, what happened last night, like proved why you always have to make sure that you're doing all your checks. And also make sure that you're listening to your patient and seeing the changes, because I had, like, my patient was starting to have a lot of symptoms that was a little bit different than what she's been having. It seemed like she was having increased anxiety, increased pain. Her blood pressure was super high. It was just a lot going on, and I wanted to get to the bottom of it. Like, I'm very investigative, so I don't like to just be given a whole bunch of meds and not figuring out like what is going on. Because if your patient is having like feelings that something's going on, like, who knows, it could be in some type of impending doom, like what's going on. So you have to get to the bottom of stuff before you just instantly try to give them, you know, a whole bunch of medications, PRNs and everything. Like, make sure that you're assessing your patient. So my patient was having a lot of stuff going on, so I came in the room. I just wanted to do another full assessment. It was like 11 o'clock, and of course I already do my assessments at like 8, 12 and 4. So I was coming in, starting a little early, and of course I'm about to empty out all my patient's drains. And I see, so the patient's drain was putting out like a greenish color. And then I looked, because y'all, it's dark in the room, so I'm like shining my little flashlight, and I see like a red tinge in the patient's drain, and I was like, is that blood? Like, it didn't look like a lot, but it was like, that looked like blood to me. And if a patient's had a surgery like days ago, weeks ago, and the drain has not been bloody, it should not be turning bloody again. Like, fresh out of surgery, it's okay for a patient's drain to be bloody, but not weeks or days after surgery. It shouldn't be turning back a bright red blood color. So I was like, hold on, let me turn on some light and see what's going on. Y'all, I looked at the patient ostomy's full of blood. Then I looked in the G-tube's full of blood. I was like, oh my gosh. Like, y'all, mind you, I literally was just in the room like an hour ago. So that was such an acute change. Like, that happened in a matter of minutes. And I was like, that is so crazy. Like, the patient's drain was just green. Like, how did it turn bloody like that? So of course I'm like, I'm getting my preceptor in the room, like, can you come look at this? I walk out trying to find the provider. Thankfully, the provider was right outside of the room. Typically, that's rare. On night shift, you usually got to message them and get them to come to your room, but she happened to be on the unit. So I came and got the PA to come assess my patient. PA was like, ooh, like, that don't look good. So, of course, she wants to trend the patients, like their CBC, INR, all that, check to make sure that they're not, hemoglobin's not dropping. And I was assessing that, and then pretty much it wasn't a massive amount of blood, so they just said to continue to monitor. But in the morning time, of course, the surgeons came by. I told the surgeons what's going on, and they put in for a stat CT. So just a lot going on. It was a very busy shift, but like, I'm just glad that I was assessing my patient, monitoring, making sure that things are not being missed. So I feel very good about the care that I provided. So I'm just glad that this is my last day. I do have my same patients back, so I'm praying that they are doing better, because it was a tough night, y'all. Like, that assignment was a heavy load. Like, having a patient that's on CRT doing bladder pressures and all this, and then you got another patient that just had a GI bleed. Just a lot going on, y'all. But I managed it. I did pretty much everything. I did have my preceptor help me with like a couple of things, just because my patient's CRT clotted off and I had to rechange the filter. That's very time consuming. So in those those type of situations, like, you just have to ask for help. Like, it is what it is. But the majority of everything, I gave all my meds, I did all my assessments, did all my charting. So I feel pretty good. I feel like I provided a really great care for my patients. So I will update y'all when I leave for my last shift for my vacay. And I'm so excited, y'all. I'm ready for a break. Your girl needs a break. So I'll talk to y'all later. Wish me a good shift. Bye.
So cold without you, but I'm hurting while I'm with you. And though my heart can't take no more, I keep on running back to you. See, my days are cold without you, but I'm hurting while I'm with you. And though my heart can't take no more, I keep on running back to you. Baby, I don't know why you're treating me so bad. You said you love me, don't wanna find me, and I was all you had. And all my heart is beating for you, and I can't stop crying. I don't know how I allow you to treat me this way, and still I stay. See, my days are cold without you, but I'm hurting while I'm with you. And my heart can't take no more, I keep on running back to you. See, my days are cold without you.
Hey y'all, it is the next day. It is the May 27th, and y'all, I did not come back after my shift, but I had an amazing shift. And my patients are actually doing much better, y'all, but your girl is on vacation, and I did not have no time to come back and talk to you guys. But right after my shift, I didn't even have time to go to sleep. I've literally been up for over 24 hours, y'all. Night shift is not for the weak, but I had to go straight to the airport when I got off of work. Well, I went home, took a shower, got my bags, and then went straight to the airport because my flight was leaving a little bit earlier than I thought it was gonna leave. So I just went straight to the airport. I had to spend pretty much the majority of the day in the airport. I took a little nap while I was in the airport, and then my flight was so quick, y'all. But I'm not gonna tell y'all where I'm at. If y'all want to know where I'm at, y'all gonna have to watch the next vlog so y'all can see the vacation footage. But I did not properly end this vlog, so I wanted to tell y'all that the shift went great. Your girl had a great shift, and now I'm on vacation. So I want to thank you guys for watching. Thank you for subscribing. Please comment any videos you want